My name is Linda Oji. Um, I was diagnosed of breast cancer around April in Nigeria. Initially, I didn't know what it was. I just noticed some pains in my right breast. I tried to find out what it was, and they kept on telling me it was an hormonal change or something like that until I went for a check, and I was diagnosed of breast cancer. I got scared naturally. My blood pressure rose very high. They started treating me for that. I tried so many options. While I was trying to decide on what to do, I wanted to even see how I could conserve the breast without removing it because of the psychological effect. And I started one session of chemo. Eventually, I was advised to come over here for the treatment, and well, I took it by faith. Probably that's how God wanted it. And on getting here, they did further diagnosis, and I was advised that that's actually the best form of treatment. That it's better to take out the breast entirely so that to avoid spreading elsewhere. And after we did the surgery, thank God I didn't really have any side effect as I thought I was gonna have. Actually, before the surgery, I was scared. I was scared to death. Then I was thinking, how am I going to cope with having one breast? My fiance, what is he going to think? Will we continue with the marriage? All sorts of things. But like I am a Christian, I took it by faith, and I said, look, the best thing is life first. After life, every other thing can follow. Is when you are alive, you can start thinking of childbearing. Is when you are alive that you can start thinking of your husband and every other thing. And I took it by faith, and luckily for me, and I prayed over it. We did the surgery. It was very successful. They removed all the what do you call it now?
Lymph nodes.
The lymph nodes and all that, and the recovery according to them is moving according to plan, and I'm feeling very okay. And I feel it's not the end of the world. In fact, I'm just okay. The only thing I'm waiting for is for me to just have something to put in there, probably like an alternative, so that I can dress up and look normal. And I know that once I can put on my brand, nobody knows what is wrong with you except you say it, really. And even if they know what is there, first of all, it's your life. Once you're alive and you're healthy, then every other thing can follow. Every other thing can follow. I don't think it's the end of the world. And my advice to people, yes, once you feel any pain, which is the mistake I made, I was actually feeling some pains some months before, and they were telling me all sorts of stories. Maybe it's because of the technology back in my country, but whatever it is, once you feel anything abnormal, just go for a diagnosis. Once you feel anything abnormal at all, go for a diagnosis immediately, so that you avoid, if there's an early remedy, they can do it immediately. But I still see it as early, because while I was in the hospital, I've seen cases that are worse than mine, and I still thank God that I'm alive today, healthy, and I have opportunity. And I pray that God will give me the opportunity to talk to other people and tell them that, look, you don't have to be downcast, you just have to be strong and do whatever the doctor says, follow your treatment plan, and everything will be okay. Okay, when I came to India, came to Nova Hospital, and I met with Dr. Rajendra Sagu, and she actually advised me and told me the side effects of having that particular type of surgery and the advantages that it has over, probably delaying further and doing conservation and all that. And she was able to, counsel me and put my mind at rest, because initially I was actually skeptical and a bit worried, and I was also thinking, oh, would it affect childbearing part of it? But she was able to calm me down and counsel and say, look, this is actually the best form for now, because by the time they do that particular type of surgery for me, it will give us a better chance of making sure that we don't have a reoccurrence, and for instance, it's even better for you to know that you're cancer free than for you to start thinking in the next few months what could happen if you had done this, if you had not done that, and all that. we went into surgery. At least I went with a clear mind and I was comfortable. And the treatment has been okay. Regular checking up from time to time. She calls, and follow up has been okay, has been wonderful. And I would just advise, like I said earlier, it's always good to make sure you are in a safe hand. Probably because she's a woman, I don't know. If you're with a woman and somebody that understands, that has empathy for you, it's like she understands what I'm going through. So it was able to put my mind at rest and make me to have that feeling that I'm in a safe hand.